big event next week too.
We do.
We have the Go Red for Women luncheon, and I wanted to make sure this was on everybody's calendar because there's less than 100 tickets left.
Ooh.
Yeah, we're going to be emceeing it, which I'm so excited about. It's right in our backyard. This is downtown Austin at the JW Marriott. 19th year that the Go Red for Women has happened here in Austin from the American Heart Association. You're already dressed for the occasion,
I know. That's
sister.
what I said. Yeah, and so many women from the community, I've already talked to them. They are excited about this. They're excited to hear from Star Jones. She's such an advocate when it comes to heart health, and I think that it'll be an inspiring time. We'll learn a lot, a lot of smiles, a lot of hugs, and more importantly, a lot of life-saving information.
Absolutely, and I believe even now we're going to learn a little bit,
Taste
of that.
Yes, we will. We have a little taste right now. Joining the show right now is Dr. Mani, and she is giving us insight when it comes to heart health, especially as it relates to women. Dr. Mani, thank you so much for being with us.
Thank you for having me.
So heart disease, as we know, is the leading cause of death among women in the U.S. Unfortunately, that's something that we've quoted for a while now. So how is it affecting women? What are you seeing in your office? Is there any indication, doctor, that this will not be the case anymore?
Well, unfortunately, heart disease affects both men and women, and obviously the risk of it gets higher as women and men get older. So I don't think it's going to go away. The goal is to detect it and try to prevent it before it does significant damage to the heart. So that's our goal, is to try to identify the risk factors and try to modify the risk of heart disease so that it doesn't affect people's lives as much.
And we know detection is certainly key. What are those symptoms, though, of heart disease that are often overlooked by men and by women?
So, classically, we think that a heart attack causes chest pain, but for a lot of women, chest pain is not necessarily the symptom that they will get if they have a blockage in one of their arteries of their heart. They may feel more shortness of breath. They may notice more fatigue, abnormal sweating. Some women describe it more as kind of a upset stomach or indigestion type discomfort. So it's important for women to realize that they may not have the classic chest pain that we normally think of for heart attacks.
And what would you advise to women as it relates to living a heart healthy life? Is there a certain age you should go to the cardiologist? What should you be doing to ensure that you're doing everything you can to have a life that's healthy?
So what I typically find is that a lot of women don't necessarily see a regular doctor. They may, when they are in their 20s and 30s and having children, they may see an obstetrician or a gynecologist, but then they kind of get lost until they are in their 50s or 60s. It's important in their 30s and 40s to kind of get established with a primary care doctor so that they can get assessed for any risk factors for heart disease like high blood pressure, diabetes, high cholesterol. These are things that if we can treat them early, we can try to prevent heart disease later on in life.
Such important information. Dr. Mani, thank you so much for your time and for just everything you're doing for women and men in our community.
Thank you so much.